staying healthy, staying sexy, staying young is what living life is all about. And if you have doctors that have proven treatments that keep people young and healthy so they don't get sick, um, you want people to know about these treatments and that they exist.
This episode is brought to you by Gainswave. Gainswave is a treatment done at your doctor's office to optimize erection quality without the need of Viagra, Cialis. It's non-surgical, there's no needles, and it has an amazing success rate. To find a Gainswave provider, go to gainswave.com. That's GAINSWAVE.com. So this is Mark L. White with Health Hacks, and today we have Dr. Anthony Cavazos, otherwise known as Dr. C, joining us. You're in New Jersey, you're telling me, but your practice is up in Michigan, right?
Well, no, I graduated from University of Michigan, and so I've been a sojourner for a number of years, and then landed in Jersey approximately 20 years ago. So I've trained in Pittsburgh, did some ER work in Ohio, and then came out here with three young kids and my first wife, and then opened up 360 6 years ago with my second wife.
So DRC 360, you started it 20 years ago, but I don't think you went to medical school to become an age management doctor. What was your first love?
You know, my first love was just trying to get to the source of an issue. I went into family medicine at Michigan, and that was really a very nascent specialty. There weren't many of them around, and I kind of got pulled into different directions from some of my other special subspecialty mentors. And I said, no, I like kind of getting to know people and understanding the social aspects of their well-being. And then I went into ER because I liked that adrenaline rush. Did that for about 10 years. And again, it was somewhat frustrating because you could take care of an acute problem, but then I saw more to it. And so I've always been driven by trying to get to the source of an issue. Just giving a person ibuprofen for inflammation wasn't very satisfactory if, in fact, you could figure out, oh, there's an autoimmune issue or there's a vitamin depletion. And that was much more appealing to me. So that's when I started taking more courses and study in A4M and other like-minded institutes, and then got fully certified, and kind of the rest is history. It's a wonderful practice because people are very savvy nowadays with their health, and they don't really just want a band-aid, so to speak. They really want to try to understand their chemistry, and that's what we do here.
So, as a family practitioner, when you went to your associates and said, "Hey, I don't want to treat sick people anymore, but I want to keep healthy people healthy," did they look at you like you were crazy?
Uh, Actually, not really. It was more my, I hate to say it like this, but I'm never going to talk down to any of my peers, but it was actually more the medical institutes, if you will, the establishment. They're like, what are you doing? You got to, how many people you got to see. They were very highly critical of me kind of endorsing this whole model. And so I actually got more flack from other physicians, to be quite frank with you. So, but I've always,
Why do you think that is, by the way?
that's a great question. I think some of it is maybe a turf kind of thing. I think some doctors are very, protective of kind of their little niche. Number one, number two, I think there's a big influence, quite frankly, on big pharma. And not to get too political, but let's face it, they make billions of dollars by giving us statin drugs and other chemicals that have a lot of bad side effects. And I'm not I'm not going to just put my patients willy-nilly on something without first understanding potential side effects. I think that's a big part of it, and then I think some of it's ignorance. I think they just don't know it. And so, for instance, when you look at lab references, yeah, there's a who establishes these references? I mean, it's very fascinating when you look at it, kind of the whole history of medicine, and we used to be the ones to also go to the houses and do a lot of other things that just kind of get lost in the shuffle when it comes to wellness. And so I think they need to open up about it and hopefully learn more about what we do here at 360, because people are demanding it, and it's a very privileged place to be quite frank with you. And it's much more satisfying when you actually see a patient come back several weeks later and they have, instead of their head being kind of sunken in and their chest being all stooped, that they're walking with a saunter. And it's because you just replenished something that they were depleted in. And instead of, they said, gosh, I just got off my antidepressant, my mood is elevated, I have clarity of thought, I don't have the brain fog. And I'm like, that's great, Mrs. Jones, and then it grows from there.
So you've been doing this 20 years, which I guess in age management, that's kind of a lifetime, because the A4M, which is the American Academy for Anti-Aging Medicine, they were established in the late 90s, I believe. So there wasn't really a support or training group for docs. How has the whole industry changed? Because it's now becoming age management is, and correct me if I'm wrong, but I believe it's becoming somewhat more mainstream and accepted now.
Uh, it is definitely, and I think also some of this is geographically influenced. Mark, that is, um, uh, A4M is based in Florida. I've been doing IV drips for a number of years, and I think in California and in Florida, I might be exaggerating this, but you'll see IV drips and other things almost on as common as a hair salon in every store corner, or I mean block. But
Almost.
here in Jersey, people are a little more skeptical, I would say. They research everything. Not that people don't research things in other parts of the nation, but it's a different vibe here. And what has changed, I think, too, is people are understanding things are integrative. I've been associated with other medical providers. I have several physician assistants, nurse practitioners. I had an acupuncturist with me who kind of moved on. I was associated once with a chiropractor and other people that, nutritionists and other people that kind of understand that what what can work for one patient, it may be more of a combination of things. So I think that's also helped a little bit too.
No, I think it's interesting. You're talking about geography, and we're down in Florida, and you're almost right. There is a age management or a med spa on almost every corner. It seems to be true for Texas, California. It's like the Sun Belt states, and I'm wondering, is it just that people like to go outside more and they're more into their looks? Because like in the Northeast or Midwest, you don't see that, and I'm curious to hear your opinion on why that is.
Hmm. Well, I do think it's changing slowly but surely. You are right. I think being outside, Arizona too. I've vacationed there, and there's some beautiful spots in the west and in the south. You are correct. People seem to be a little more engaged in outdoor activity. And so, therefore, if they're having some joint issues because they're doing a lot of hiking or cycling or running, uh, they're going to go seek some attention to get that sorted out, as opposed to maybe here we're a little more weather bound and possibly a little more reticent to seek certain care. And I would say, growing up in the Detroit area, people are also slow to go to docs. I remember one time I fell off my bike, and I mean, my whole elbow was ripped open, and uh, it was all gravel and everything. And I played tennis for like an hour or so with my friends. I just kind of put something on it. I don't even know what I had, and then I get home and my mom's like, "What is that?" And she's like, "Ah." I can clean that up. And then, it's funny, you don't go rushing to the ER for everything, I guess is how I grew up anyways. And so I think that's part of it. But it's changing. It's slowly changing. We got the baby boomers now that are um, wanting to, they say that the current 60 is like the new 50 or 40 and that kind of thing. So they are trying to, they see their parents failing, and they don't want that for themselves, and so they are starting to reach, kind of research it more and seek out providers that can offer that.
Yeah,
So
yeah. I also think like with the rise of the internet in the last 20 years, we no longer have to get our information from big pharma or from
mhm.
traditional medical care. We can now look at the studies ourselves and view the research ourselves and hear alternative voices without them being shut down. Have you noticed that as being a trend?
I think that's a great point. Yes, seeing even a lot of millennials and such. That, I mentioned baby boomers, but that's certainly not the full breadth of our practice here. So we see a lot of young people say, "Hey, can I do this recovery drip? Can I do this drip to help with my cognitive abilities? I'm studying for my bar exam or my to become an accountant. Was it the CPA exam? These kinds of high level exams, and I need a little more focus. I don't want to go on Adderall or Vyvanse. I want something, that I know is safe for me and doesn't have any, adverse effects. So I think you're exactly right. And there's a lot of podcasters out there now. Again, you got to be kind of savvy and careful because we do see a lot of patients coming in and with misinformation, and then
Yeah.
you have to spend your consult time uh, dismissing it if it's truly bogus, or trying to kind of re-educate is the term I was trying to find.
Now you mentioned that you're getting a lot of younger people. Is the IV therapies, are you seeing that as their first contact with you? Is that pretty much what the younger people start on, and then later as they age are looking more at the hormone optimization and peptides, or do you see younger people also doing peptides and some of the other things that you do?
Right. So probably 40% of the new clientele are coming in, initially for that IV drip. Again, maybe they had a heavy night of partying, or but that's not the primary one. It's usually we see a lot of athletes, a lot of people looking for recovery. Just had an athlete going to the nationals for one of the premier breaststrokers in the nation, and he just wanted something to help. He's been worn out training, and so we do that, and that's all legit. There's no problems with, it's not a doping issue or that kind of thing. It's all organic. So he was, very excited. And actually, after this podcast, I'm going to follow up how he did. It was this past weekend, and he was traveling back to Jersey today. But the funny thing is that they will do a lot of blood work here, and just to find out if they have there's a big variant mutation called MTHFR. In a word, it just means you can't efficiently methylate, which is a very important way to process uh, chemical reactions. And so, if that's what's going on, then there's other ways to help them in addition to the IV drips. So we do a lot of blood work here. We really want them to know what their chemistry is on day one. We do a body composition analysis, and then some people need some weight loss. Some people, uh, want you know want other therapies that we offer in addition to the drips.
Now we're about a year into this pandemic. Um, have you seen an increase of people that are coming to you because of what's going on with COVID and they want to stay healthy because they're worried about their immune function?
Most definitely, Mark. There's been a lot of studies coming out, and a lot of people promoting D3 and I'm sorry, zinc and vitamin C. And we do IM injections as well as, so you can, if you don't have a time to sit for a 45-minute to an hour drip, then you can get the vitamin D and some of the other micronutrients through an intramuscular injection, which is much more, I guess, quick, so to speak. But yes, in a word, yes. And I also think uh, the weight management part of our practice has grown because people weren't able to go to gyms, and they weren't, they were hunkered down, and they put on, I don't know if it's called the COVID 15, like the freshman 15, or it's the COVID 30, but
I
we've had
like
a
that.
number of people who have said, listen, doc, I know too obesity is a risk uh, for not just COVID, just for diabetes, for hypertension, for a lot of dysfunctional metabolic dysfunction.
Yeah. So with the IV therapies, you do a lot of the vitamins, and I've heard about NAD plus,
Mhm.
which I guess that's for brain function. Are you offering that to your patients?
We recently offered that. Again, I like to research everything and understand it myself, and then try it. I am kind of my own guinea pig in all of this stuff. That's part of just who I am. I want to kind of understand it and do it myself. So I've recently have started offering that, and I have to tell you, the people that we've offered it to, myself, included, it helps with cognitive function. It's a really fascinating, really almost like a coenzyme, because NAD is really trying to push the mitochondria, which are those powerhouse cells, that to make more energy. So you need, I believe the two largest organs with the most concentration of NAD are in both the brain and in the heart. So it's been helping people with heart disease, people with, again, it came out, I think, in 1960, more for alcohol withdrawal and addictive potential, people with addictive behaviors. But you'd really have to do a series. And the issue with those drips, one of the issues is that if you give it too quickly, patients are going to start sweating. They feel almost some chest discomfort or heart palpitations. So you kind of have to tone it down, and to really be effective, it's really a 2 to 3 hour drip. So that's probably the the one biggest negative, is it takes a while. But I have to say, it's a very fascinating molecule, and I think we're learning more and more about who can really benefit. There's been a lot of studies that Alzheimer's patients, people that suffer from Parkinson's disease, can benefit, because again, it's upregulating dopamine, serotonin, and so of course it helps with mood. But it's like regenerating the broken down neurons and the connections, and I think that's what it's really about. It's really connecting with other good neurons, and regeneration, in a word.
And I know that you are also really big on the peptide therapy. What are some of the most popular peptide therapies, and why would people need those?
So peptide therapy, the first one is called sermorelin. It was discovered in 1970, and these peptides are growth hormone releasing hormone analogs. So they look like growth hormone releasing hormone, which is made in our hypothalamus, and it trickles down and tickles the anterior pituitary, and that's where growth hormone is made. Now, what happens as we age, and usually we're not talking you're going to get taller here from peptide therapy, but your bones fuse about probably 18, 19 in a young man, and a young lady probably 16, 17. So you're not going to get taller with this, but what happens is that your amplitude of growth hormone is decreased as we age. So usually after 25, 30, we're starting to decrease. In fact, the studies say by the age of 50, you've lost 80% of the amplitude of your growth hormone. So growth hormone's pulsed during the day 7 to 9 times, and it's supposed to be maximally pulsed about 70% of it, Mark, during 11 p.m. and 2 a.m. when we're sleeping. So one of the first things people, kind of notice is they're like, man, I'm not getting that restorative sleep. I wake up, even though I slept 7, 8 hours, I feel tired. I'm sluggish. I'm falling asleep in the middle of the afternoon. I need my 5 hour energy drink or my espresso. And so what we do is we test IGF-1. So it's a blood test. IGF-1 is made in the liver as a response to how robust your growth hormone is pulsing. And if that's under 200 for most women and under 300 for gentlemen, then you can do the peptide therapy. And that's a little micro injection with an insulin needle. And what it's doing, it's sending happy signaling to your anterior pituitary to just pulse a little more. But the clever thing about it is you don't get a tolerance and you don't mess up the negative feedback loop. So you're not really um, you're not dependent on it. So it's a hormone booster, and you stay on it 3 to 6 months, and then you can come off it. And people are experiencing again better energy, better focus, bone density scores go up, immune function goes up, uh, your joints don't ache. You're making more collagen. You get a luster to your skin. Your restorative sleep comes back. So you're recovering very quickly, and you're leaning out. You need growth hormone to lean. And a lot of people coming in, they're like, I'm killing it at the gym now. They're back open. I'm doing this, eating right, and I have this stubborn little this fat in my belly. I can't get rid of it. And I check their IGF-1 levels, and they're in the basement. And we just here now kind of boot the whole kind of program a bit.
Why not just take growth hormone? Why peptides over the growth hormone therapy?
Well, I think for two reasons. First of all, growth hormone, which I'm not against, and I do prescribe that for some of my patients who especially don't respond to the peptide therapy, would be I guess two main reasons. First of all, you do need to be careful if you go a little too high on the dosing, and it's very particular. Usually, our physiologic doses are 2 to 3 IU's a day. If you go a little bit higher, you're going to get carpal tunnel syndrome. You will get skeletal growth. And you probably have seen maybe some people that are doing too much and they almost, their skeleton, like they almost get the shelving above their brow. Their hands start, like I said, they get expansion of the tendons, and they suffer carpal tunnel. They retain water. They start getting liver issues. So there are a lot of side effects if it's not being really supervised well. And probably then the second most negative on it is it's quite expensive. It's typically not covered by medical insurance, and except for a couple of rare medical diseases. And so if you're doing it more for regeneration and wellness, the typical layout's going to be to 2,500, 2,000 to $2,500 a month. So for a lot of people, it's a little bit tough to go at it, and then you almost become a little tolerant at a certain point, and you got to then go up, and it's almost like that kind of vicious circle. Peptides, on the other hand, you're just telling your body and your pituitary, if it wants to upregulate. So the nice thing about that is no side effects, except for sometimes you get some hunger and a little bit. I can talk more about what most patients have suffered, but it's about 10% or less. But extremely safe, doesn't cause a rogue cell to go crazy in terms of, God forbid, cancer, doesn't cause liver toxicity, and you can literally stop it at some point and now you're upregulated. Usually we see people kind of hone in that nice zone, I call it, for about a year and a half, and then you have to redo the protocol again.
What are you excited about with the future of age management? I know they're always innovating, coming out with new things, but what do you see as being really big over the next 5 years?
I'm seeing exosomes as a big thing. These are pieces of protein from stem cells, and we've been starting to use this, seeing it used. It's been used topically for people with burns and wound healing. But when it's given intravenously, it can be. We've had people literally with totally, almost total disabled back disorders. And I don't mean that they had a herniated disc that might need surgical intervention. I'm talking about just that degenerative disc disease issue, which is just wear and tear. And they have now, and I've had other patients with diabetic neuropathy, it's a regenerator. And I think exosomes and going down that path is very exciting. Again, it's not totally FDA approved for that. They did just get a study approved, or I mean, an indication for COVID patients that were literally ventilator, bound and dependent, and were on their last breath practically. And it's actually, one of my colleagues did a really nice study out of Brooklyn, and I think it was, no, more than that. It was almost 60% of the patients actually came off the ventilator and actually went home, which is shocking because this was before even the Regeneron and stuff like that. So they already have an indication, this company, for treating COVID. So I think it's a fascinating advance.
Do you think, talking about stem cells versus exosomes, do you think people are going to start using more stem cells, or go towards more of the exosomes?
Right. Well, I think two things. I think stem cells, again, they're DNA. So in theory, even if they're kind of washed and cleansed, you still worry about potential disease. Just like when somebody needs a blood transfusion, you do the best screening test you can, but sometimes viruses are sneaky, and they will kind of not catch them, and then a person gets Hep C, Hep B, something else down the road from that. And that's the same thing with stem cells, Mark. They cannot be totally washed out, so you can still technically suffer something down the road. Uh, Unlike exosomes, they're RNA, so they don't transmit any diseases. So I think that's a big advantage. And I think too, the sourcing of it is getting much better. So most of the companies are using either bone marrow or placenta, and stem cells. Sometimes there's more of an ethical challenge to it, so to speak. So I think exosomes are the way to go.
Now, I've been reading about these long haulers. These are people that have COVID. They've recovered from COVID, but they have ongoing issues. You hear about brain fog, problems breathing. But recently, I read a report, I think it was by the University of Rome, that said 30% of all men who have contracted COVID are going to suffer from some sort of erectile dysfunction because it's breaking down the blood vessels in the penis. Have you seen an uptick of guys coming to you with issues from COVID, and have you seen an increase in ED patients?
Well, that's a great question. I believe I have seen an uptick in people with ED now. I didn't really put it together, possibly that it's COVID related, because we do see a wide swath with people with low testosterone, and so we try to do an integrative approach. I am a gains wave provider, so I do believe in the acoustic pressure wave therapy for sure. We also do PRP and exosomes for penile rejuvenation. But that's an interesting comment. I'll have to pay really close attention to that. I think the other thing out here in Jersey, people are really pushing the vaccine and stuff, which is okay. I just wonder too, down the road, are there going to be potential backlash on that? And I'm thinking more that younger generation. uh, Unfortunately, I just heard the Johnson and Johnson vaccine got pulled off, so you don't know if that's also going to be a part of that puzzle, or be a issue down the road. But yeah, I do think that that makes some sense. And I think too, because we know COVID causes clotting, people that were on blood thinners did much better. That's fascinating. But that's what I love about the gains wave. They actually regenerate blood vessels, right? That's part of the way it works, and that would be also something where PRP or potentially exosomes could help out.
Well, I really appreciate the time, doctor. I know that you're very busy up there, so thank you so much. I enjoyed having you on the show, and we appreciate everything you do, and I just wish you the best of luck.
Thanks so much, Mark. Great. Have a great day.